national priority programs of the National Health Laboratory Service, and together with Wits University, we are working on the EQUIP program under the viral load scale-up activity. So Wits University and the NHLS come with a wealth of experience and skills in implementing large-scale national laboratory programs. And we've been involved in scaling up CD4 testing for South Africa, HIV viral load testing. We've also implemented and scaled up the early infant diagnosis program, and in addition, TB diagnosis with the gene expert. So we have come with this wealth of experience to contribute towards the EQUIP program, specifically for viral load scale-up in a number of African countries. And currently we're working in 10 countries globally, and working together with the Ministries of Health and various in-country stakeholders to improve their viral load scale-up programs. And certain activities that we've been involved with is, first of all, laboratory assessments. So we have designed a rapid laboratory assessment tool, and this is aimed at assessing every single laboratory in a country, specifically pertaining to HIV viral load testing, in terms of type of laboratory staff that is available, quality assurance within the lab, equipment that is used, and laboratory infrastructure. And this is working together with a GIS mapping team, so that is a Geoinformational Spatial Mapping team, and they are mapping every single health facility in the country in terms of its infrastructure, water requirements, power requirements, as well as road infrastructure. And together with that team and a health economics team that is doing costing, we are putting together a comprehensive and thorough model for the best placement of HIV viral load testing within Zambia. In addition, we have also been working on introducing some innovative technologies for strengthening the pre-analytical and the post-analytical sides of viral load testing. So we are working on improving specimen logistics, specimen collection and specimen receiving at the laboratories, as well as cold chain monitoring of those specimens. And then on the post-analytical side, we are working on trying to get the result back to the patient and the healthcare facility as quickly as possible. So we are busy developing a mobile app that is known as eLabs, and this is available on either a mobile phone or a tablet, and can be used by the driver of the specimens as well as by the healthcare worker. And this will also be sending out alerts to the patient to go back to the facility to get their result, as well as alerts when there is an HIV viral load that is greater than 1,000 copies per mil. And we're working on a number of activities in Zimbabwe as well. So we've been working in one district, Chitungwiza, and actually setting up an HIV viral load lab from scratch, and assisting this lab with technology selection, with documents for standard operating procedures, quality assurance, and verification of the analyzer. And we've assisted this laboratory with going live and scaling up access to viral load testing for the facilities that are in the near vicinity. So all of these activities are working towards strengthening the third 90 of UNAIDS 90-90-90 goals, and that goal being to increase the number of patients who are HIV positive being virally suppressed. The viral load scale-up activity fits in together with the entire EQUIP mandate, which is to improve and strengthen on the UNAIDS 390s. So the first 90 being number of people who are HIV positive to know their status and to have been tested. The second 90, those who are HIV positive to have begun antiretroviral treatment. And the third 90 for those who are on ARVs to be virally suppressed. So all these activities are being carried out by the different core partners within EQUIP, and NHLS Wits comes in with the third 90 to strengthen number of patients being virally suppressed. And I think we all work together as a really good team under EQUIP to try and reach those 390s.